Menopause. Menopause is a natural event in a woman's life. The age for normal menopause is 45 to 55 years of age. A woman has said to have achieved menopause if she has had no menstrual cycle over the past 12 months. So the period before the menopause is called the perimenopausal phase. So most of the symptoms which the women experience are actually experienced in the perimenopausal phase, which some of them may extend into the menopausal and hence the postmenopausal period. So the common symptoms which are usually experienced by the patients during the menopause or the perimenopause are hot flashes, thinning of hair, weight gain, vaginal dryness, osteoporosis, mood swings, etc. So I'm going to take two very common symptoms and very important ones for which people have been approaching to me for homeopathic treatment. So the first symptom is hot flashes. Hot flashes are actually called the vasomotor symptoms. They are usually exhibited in the form of extreme feeling of heat or hot flushed face and profuse sweating. This symptom is very troublesome to women because it causes sleepless nights and hence mood temperaments and irritability. So the management of hot flashes can be done by keeping yourself cool. Avoid wearing tight clothes. Wear loose clothes. Wear them in layers and use a fan or air conditioner if required, and avoid spicy food and aerated drinks because these have been known to trigger hot flashes. And whenever you experience hot flashes, try taking deep abdominal breaths, which will help to calm you down and relieve your hot flashes to some extent. Hot flashes also need to be treated because it is usually and sometimes it may be a cause of some heart condition or breast cancer. The second symptom is irregular bleeding. Irregular bleeding may exhibit itself in the form of spotting, abnormally heavy bleeding, lighter cycles or missed cycles. Now, if we speak of the spotting is very light bleeding or a pinkish reddish spots which are usually noted in your undercloth. Spotting usually results as a result of hormonal changes. It may be experienced at the start of the cycle, at the end of the cycle, or in between two cycles at the time of ovulation. So disposable liners can be used, which are available at all drug stores. Abnormally heavy bleeding results when your estrogen levels are very high as compared to progesterone, which results in the thickening of the uterine lining or the endometrium, resulting in heavy bleeding. This needs to be treated because prolonged bleeding may result in anemia and blood loss, and it may also affect the heart condition. Then we have shorter cycles. This happens if your estrogen level is low and the progesterone is high, resulting in thin uterine lining and less bleeding. Missed cycles. As regarding missed cycles, even if a woman is having 2 cycles in 12 months, this means that she is ovulating and she might get pregnant. So care needs to be taken. So as regarding homeopathic treatment, homeopathy has been extremely successful in treating the symptoms of menopause, because though the basic cause, the varying hormone levels are the cause, but in homeopathy, when the case taking has been done, we have found different root causes of the varying hormones in each person. So it helps in individualized treatment of each person. So that was all for today. Take care and keep praying. God bless.